It's week 3 of free cancer support services being suspended at Guam Cancer Care in Tamuning.
It's been hard, hard in a sense that, our patients are calling in and because of our current status, we can't provide them the full-on gamut of what our programs provide to the community.
Ellie Ungrong is a senior patient navigator here. The issue is a result of a lack of funding given to Guam Cancer Trust Fund. Senators had to pass a supplemental budget bill to get them the money. But the holdup has left the staff at Guam Cancer Care with no choice but to provide limited services and use supplies from the prior grant year.
Not in what they expect. Usually we were able to fulfill the full order of the provider, but with what we have available on stock is what we are providing currently to the patients.
1,315 active patients use the services here. 6 staff members, including Ellie, are doing all they can to keep patients' worries at bay. They are now waiting for the grant funding to be released from the trust fund. Until then, they are unable to enroll newly diagnosed patients.
So what we've been doing is kind of like holding their names. And then once we can get back to funded status, we can process them fully.
Man, this is no good.
It's not. I've had patients call in crying. It's very heartbreaking.
A main service offered is the Financial Assistance Program, a program that goes to the providers to ensure there is no issue for patients getting treatment.
The patients are calling in and they're like, what do we do? I can't pay the copayment. How am I going to get my IV this week or next week or in the next 3 weeks if your status is this?
Ellie and her team are left searching for other options as well until they get the required funding.
If it's a cycle that can be pushed maybe a week or 2 weeks back, they'll go ahead and do that until in hopes that we get funded again.
Okay, but if it's more severe?
If it's more severe, in the interim, myself and my provider POCs for the clinic side, we're looking at what we can do on behalf of the patient so that if this status continues, there is a way that we can find for the patient to continue treatment.
Guam Cancer Care applied for the grant funding last week and are awaiting approval, leaving cancer patients with no choice but to wait for treatment.